Hello and welcome. Today we're diving deep into a significant topic in neurology, transitional cell carcinoma, also known as CC or urothelial carcinoma. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Let's start with the causes. While the exact etiology of transitional cell carcinoma isn't fully understood, several risk factors significantly increase the likelihood of developing the disease. The most prominent is smoking. Cigarette smoke contains carcinogens that are excreted in the urine, exposing the lining of the bladder to these harmful substances. Occupational exposure to certain chemicals, particularly those used in the dye, rubber, leather, textile, and paint industries, is another major risk factor. Chronic bladder irritation, caused by conditions like recurrent urinary tract infections or bladder stones, can also contribute. Finally, certain medications, such as the chemotherapy drug cyclophosphamide, have been linked to an increased risk of TC. Now, let's understand how TCC develops. Transitional cell carcinoma arises from the transitional cells, also called urothelial cells, that line the urinary tract, including the renal, pelvis, ureters, bladder, and urethra. These cells are unique because they can stretch and contract without leaking, allowing the urinary tract to expand as it fills with urine. The carcinogenic substances damage the DNA of these cells, leading to uncontrolled growth and the formation of tumors. These tumors can be papillary, meaning they grow like small mushrooms into the bladder lumen, or flat, often indicating a more aggressive form of the disease. The tumor can remain localized, invading only the lining of the urinary tract, or it can spread deeper into the bladder wall and eventually metastasize to distant organs like the lymph nodes, lungs, liver, and bones. Let's discuss how widespread this disease is. Transitional cell carcinoma is the most common type of bladder cancer, accounting for over 90% of all bladder cancer cases. It is also one of the more common cancers of the urinary tract overall. The incidence of TCC increases with age, with most diagnoses occurring in individuals over the age of 60. Men are more likely to develop TCC than women, and Caucasians have a higher incidence compared to other ethnic groups. The geographical distribution also shows variations, with higher rates observed in industrialized countries, likely due to occupational exposures and smoking habits. So, how does someone know they might have TCC? The signs and symptoms of transitional cell carcinoma can vary, but the most common and often the first sign is painless hematuria, or blood in the urine. This can be visible, appearing as pink or red urine, or it can only be detected under a microscope. Other symptoms may include frequent urination, urgency, a burning sensation during urination, and difficulty urinating. If the tumor has grown large or is obstructing the urinary tract, patients may experience flank pain or lower back pain. In advanced stages, symptoms related to metastasis, such as bone pain or unexplained weight loss, may also occur. Diagnosis of TCC typically involves a combination of tests and procedures. A urine analysis is often the first step, looking for blood and cancerous cells in the urine. A urine cytology involves examining urine samples under a microscope to detect abnormal cells. Cystoscopy, where a thin, flexible tube with a camera is inserted into the bladder, allows the urologist to directly visualize the bladder lining and identify any suspicious areas. If abnormalities are found during cystoscopy, a biopsy is performed, where a small tissue sample is taken and examined under a microscope to confirm the presence of cancer cells. Imaging tests such as CT scans, MRI scans, and intravenous pyelograms are used to determine the extent of the disease and check for spread to other organs. Transitional cell carcinoma is staged using the TM system, which considers the tumor size and depth of invasion XT, involvement of regional lymph nodes N, and presence of distant metastasis EMT. The stage of the cancer is a crucial factor in determining the appropriate treatment approach. Broadly, we can classify TCC as non-muscle invasive bladder cancers and MIBC, where the cancer is confined to the inner lining of the bladder, and muscle invasive bladder cancer MIBCA, where the cancer has spread into the muscle layer of the bladder wall. High-grade tumors tend to be more aggressive and more likely to recur or progress. The specific stage and grade of the tumor will dictate the treatment plan. Treatment for TCC depends on the stage, grade, and location of the cancer, as well as the patient's overall health. For non-muscle invasive bladder cancer, treatment often involves transurethral resection of bladder tumor, or TURBT, where the tumor is surgically removed through a cystoscope. Following TURBT, intravesical therapy, which involves instilling medication directly into the bladder, is often used to prevent recurrence. Common intravesical agents include BCG, an immunotherapy drug, and chemotherapy drugs like metamycin C for muscle invasive bladder cancer. More aggressive treatments are required. Radical cystectomy, the surgical removal of the entire bladder, is a common option. Chemotherapy, often before or after surgery, is used to kill cancer cells throughout the body. Radiation therapy may also be used in certain cases. In some situations, a bladder-sparing approach combining TRBT, chemotherapy, and radiation therapy may be considered. Treatment options are tailored to each individual patient's needs and circumstances. While there's no guaranteed way to prevent TCC, there are several steps you can take to reduce your risk. The most important is to quit smoking. Avoiding occupational exposure to harmful chemicals is also crucial. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can support overall health and potentially reduce the risk of cancer. Staying well hydrated can help flush out potential carcinogens from the bladder. If you have a history of recurrent urinary tract infections or bladder stones, seek prompt medical attention to address these conditions and prevent chronic bladder irritation. The prognosis for transitional cell carcinoma varies widely depending on the stage and grade of the cancer, as well as the patient's overall health and response to treatment. Non-muscle invasive bladder cancer has a relatively good prognosis with high rates of survival. However, recurrence is common and regular monitoring is necessary. Muscle-invasive bladder cancer has a less favorable prognosis, but treatment can be effective in many cases. Recent research has focused on developing new therapies, including targeted therapies and immunotherapies, to improve outcomes for patients with advanced TCC. These advances offer hope for more effective and less toxic treatments in the future. Scientists are also studying genetic markers to predict which patients are most likely to benefit from specific therapies, paving the way for personalized treatment approaches. Thank you for watching, and I hope this video was helpful.